How does liver drug metabolism affect older adults on multiple medications? Imagine your liver as a busy factory that processes all the medicines you take. As we age, this factory slows down, especially in how it handles multiple medications at once. This slowdown can change how drugs stay in your body and how long they work. For older adults taking many medicines, this can mean higher drug levels, which might lead to side effects or even toxicity. One key change is that blood flow to the liver decreases with age. Normally, blood delivers medicines to the liver for processing. When blood flow drops by about 40%, the liver gets less of the drug, making it harder to clear from your body. Also, the size of the liver shrinks by roughly 30%, reducing its capacity to process medications. These changes mean drugs that relying on blood flow for clearance stay longer in the system, increasing their effects and potential risks. Another important factor is enzyme activity, especially involving a group called cytochrome P450 enzymes. These enzymes help break down many medicines through a process called oxidation. As we get older, the activity of these enzymes tends to decrease, especially in phase 1 metabolism. This slowdown can cause drugs and their active components to build up in the body, raising the chance of side effects. However, phase 2 metabolism, which involves attaching substances like glucuronic acid to drugs to make them easier to eliminate, tends to stay more stable with age. This means drugs processed mainly through phase 2 pathways are often safer choices for older adults. Adding to the complexity is that each person ages differently. Some may have more significant reductions in liver function than others due to genetics, lifestyle, or health conditions. This variability makes predicting how a medication will behave in an older person more challenging. When multiple drugs are involved, the risk of interactions increases. Some medicines can inhibit or boost liver enzymes, further complicating how drugs are metabolized. This can lead to higher drug levels or reduced effectiveness, both of which can be harmful. From a liver health perspective, impaired drug metabolism can cause the buildup of medicines that might harm the liver itself. For those with existing liver problems or liver cancer, these changes are even more critical. Reduced clearance can worsen liver injury or interfere with treatments. That's why healthcare providers carefully choose medications, adjust doses, and closely monitor older patients on multiple drugs. Practically, it's best to prefer medicines processed through phase 2 pathways when possible. Regular checkups to watch for signs of toxicity are essential. Using tools like the Beers criteria helps identify medications that might not be suitable for older adults. Sometimes, reducing the number of medications or deprescribing can help lower the risk of adverse effects. Every treatment plan should be personalized, considering liver function, other health issues, and overall well-being. In summary, aging causes the liver to become less efficient at processing drugs due to decreased blood flow, smaller liver size, and slower enzyme activity. These changes can lead to higher drug levels and increased risk of side effects in older adults taking multiple medications. To protect liver health and avoid complications, careful management, dose adjustments, and regular monitoring are key. Always consult healthcare professionals for personalized advice, especially when managing multiple medications or liver conditions.